Insurance and Labor Committee meeting to order. If I could get everybody's attention. Thank you, Vice Chairman Walker. We need Melis's gavel, don't we? All right, I'm going to let Chairman Watson return thanks. Are you 5? 4. Okay, thank you.
Thank you, Chairman. Let's bow our heads. Dear Lord, thank you for looking over us and continue to keep us safe in our travels and continue to look over us and let us make appropriate and wise decisions in your name while we're here. In Christ's name I pray. Amen.
Thank you. We've got two bills on the agenda that we'll try to get through. We've got a hard stop at 2 o'clock because most of us have another committee meeting to go to. So the chairman will think highly of everyone who speaks very briefly and succinctly and to the point. And let's see, any other way I can put that. We want to do what we need to do to get the people's business done and not one word extra. So Dr. Kirkpatrick, we'll recognize you, and we're going to start with Senate Bill 342, right?
Correct. Do you want me here or over there?
I don't care. Where do you want to be? All right, what's your number?
It's all the same to you.
6. Yeah, all the same to me. Just give us that substitute number so make sure everybody's got the right bill.
Sorry, let me get my papers together. I've got LC 520067S. What you got?
All right, you have the floor. Just tell us about this bill.
Okay, and I'll try to keep it short. It's a little difficult because it's a little complicated, but all of you know that mental health parity has been a hot topic down here for a few years. And it turns out that under Georgia law, there are no specifically delineated reporting obligations for insurers to demonstrate compliance with existing federal parity requirements. This bill establishes a framework for annual uniform reporting to ensure that Commissioner John King and the Department of Insurance receive all the necessary data to assess compliance. Senate Bill 342 does not create an additional state coverage mandate for insurers, but it does apply to all insurers subject to the laws and regulations of Georgia or subject to the jurisdiction of the commissioner, which provides mental health benefits or substance use disorder benefits. And so let me just walk you briefly through the bill. The first part is all definitions, but I'll take you down to line 62, which basically says that each insurer reports on the 5 healthcare plans with its highest enrollment in each classification, individual, small group, and large group. It also requires them to prepare this report and to report it to the commissioner no later than January 1st of 2023, and it contains all the things that go from line about 73 down to about 86, which includes all the federal parity requirements. And it also gives the commissioner the ability to ask for additional information. That's on line 86. The report has to be compliant with the Parity Act, the federal act, and also the insurers then have a public reporting obligation to consumers for additional transparency and accountability, and that's in line 99 through 103. So the report will go onto the insurer's website. And then the commissioner has additional independent public reporting obligations for consumers, and that is structured in such a way that it's a summary report, because probably most of you who work in healthcare would know that raw data isn't always very useful because consumers looking at it can't really tell what they're looking at. And so this is intended to be structured in a way to enable comparison by consumers. And then the last section is about penalties, and this is consistent with other law that we have that relates to the Commissioner's office. So in short, parity requires insurers to provide the same level of benefits for mental illness, serious mental illness, or substance abuse as for other physical disorders and diseases. And the work on this bill draws from statutes in Kentucky, Indiana, and testimony provided in a series of public hearings in Maryland over the last year and subsequent rulemaking. The goal is transparency and accountability so that the Commissioner and Georgia consumers have tools to ensure parity. And that's it in a nutshell, Mr. Chairman. I'll be happy to answer questions.
Thank you. Let's see. Senator Robertson, is that your light on?
Yes, sir.
You have a question?
I do. Thank you, Mr. Chairman. Senator, have there been any cost studies or cost analysis as to what this may do to the budget of the insurance commissioner, or maybe an average cost to the healthcare provider?
I don't think this is going to impact the cost to the healthcare provider at all. And in speaking with the insurance commissioner's office, they have assured me, unless there's new information, that they can handle it. They have, obviously, staffing issues like everybody else in state government does, and they're working on that, but they feel that they can manage this process with their existing resources.
Okay, and quick follow-up. Now, is this something readily available to the insurance healthcare providers now, so that they would not need to bring on additional personnel or go through additional steps or additional software or any of this other? Is this just a plug and play of something they already have? We're just asking them to share it?
The healthcare providers would not have to.
Or the
submit anything.
insurance company, I should say.
The insurance
Yeah.
companies can do this. They already are required under federal law to report, and we just need to back that up with state law. And the making it in a readable format on their website would be something that a consumer could look at without any additional software or anything else being needed.
Because they're already providing this under federal statute, all we're doing is requiring that they give the information that they're providing under the federal statute. Did they do it now under a state statute also?
And in a format that is, in a form that's developed by the insurance commissioner's office.
Okay, thank you.
All right. Senator Harbin, is that you with your light on?
Here.
Yeah, okay. You
Thank
have the
you,
floor.
thank you. Senator Kirkpatrick, just curious, the information that they are reporting, as I understand, currently, this is going to apply to non-ERISA plans. This will apply to plans that are not federally already mandated. So what we're doing is we're taking and applying this to all of the health care plans that are in Georgia that are not ERISA based. Is that what I understand?
It's the plans that are under the jurisdiction of the commissioner. That's correct.
Okay. The question I would have is what are they reporting informationally? You mentioned raw data. I don't know if that means it wasn't cooked or whatever, but what is the data that they're giving from that standpoint? And is there any possible violation of HIPAA in that respect of that? Or is this data not on an individual but on a whole group from that standpoint? What's being reported there?
They would be reporting the things that are outlined in those lines that I pointed out.
99?
49,355.
Well, yeah, and 74 through 85, and then anything else the insurance commissioner needs. And they would not be publishing anything on their websites that would be individual data. It would be aggregate data.
Okay. Okay. So it's basically going to report how many people have this disease or this condition, and we're dealing here more with mental because we're bringing the mental in as if that is just like any other accident, sickness, or disease, correct?
Right, we just want to be sure that they're following the federal guidelines.
Okay. Is there any cost affiliated with this that would increase the cost of health care for Georgians who are not in non-ERISA based products? Is there any kind of cost that this is going to cost here?
No.
No. Okay. Okay. Okay, no, thank you. Appreciate it.
All right. It looks like we've exhausted the questions so far from the committee. We've got some other folks that have asked to speak, so we'll run through those real quickly. Bethany Sherrill with MAG.
I am Bethany Scherer with the Medical Association of Georgia. We represent physicians across the state in all different specialties and practice settings, and we are here to support this bill. And I understand that you would like us to keep our comments brief, but I'm here to take any questions if you have any.
It might not hurt, Bethany, to kind of explain what parity is for those that are not. It sounds like some of the questions out there, maybe that's not completely understood.
I'd love to.
We'll give Senator Kirkpatrick just a break.
So from our perspective, when you're talking about mental health parity, you're talking about the need to treat behavioral health services the same as you treat other health services. So for example, if I were going to go see my primary care physician for some sort of ailment, whether that be an illness or a chronic condition, that I would not see any difference in terms of the way that my claim is paid for going to my primary care physician for what we might call like a general health care need versus going to see a psychiatrist or my primary care physician for a psychiatric need. And oftentimes you think about, it could be something as simple as that my copay is higher if I seek psychiatric care, or it could be something like I have to get a prior authorization to seek that care that I would not have to seek I wouldn't have to get if I were trying to get kind of typical health care. And this isn't trying to kind of it's trying to take away, I think one of the big things that this does is take away some of the stigma around accessing psychiatric care. When we think about the burdens that are placed and the obstacles that are placed in people's ways in order to access that treatment, sometimes it can be very expensive to get that care. And then when we think about from an access side, it's expensive to provide that care. You want to make sure that you're approaching these different types of care in the same way, because behavioral health care is health care. And that's, at the end of the day, that's what we're looking to accomplish.
Thank you. Any further follow-up for Ms. Scherer? Thank you. Appreciate you. Kim Jones with NAMI.
Thank you, Chairman Burke, Vice Chair Walker, and other members of this committee. My name is Kim Jones, and I am the Executive Director of NAMI Georgia. But first and foremost, I'm the very proud mother of a child with a mental health condition, and parity is what brought me to my job at NAMI Georgia. At the age of 9, my child was having psychosis. We finally got him diagnosed by Emory only because his heart doctor, he had a congenital heart defect, happened to have an Emory researcher in his office that day looking at congenital heart defects and mental health. So I was referred. That was after numerous meetings with many other doctors. In that meeting, what happened was they did diagnose him with major depressive disorder. And from there, at that point, at 9 years old, we were on 2 different insurance plans, a CMO because of his condition being born at 27 months, and a private health care provider. It took us 2.5 months to find a doctor in network. That was with me calling and the Emory doctor calling. We were told that they weren't accepting children. We had phone calls not answered. We had call us back, and then we call back again. So this is something that is very dear to my heart and very real for those who live with mental health. So with that, to tell you a little bit about NAMI, I want to back up and say something else. I have to add this part. At that time, my child was cutting himself, and he had suicide ideation. If you're unfamiliar with mental health for a child, the time between when they decide for suicide and complete suicide is 20 minutes. We went 2.5 months. Just so we all understand what that means to the families we're talking about. So NAMI is an organization of families and friends and individuals who lived whose lives have been affected by mental illness. Together, we advocate for better lives for those individuals who have mental illness, and we offer support, education, and advocacy as we do so. I'm here today to express NAMI's strong support for SB 342, a bill dropped by Senator Kay Kirkpatrick, a tireless champion for mental health and substance use care. This is a relatively simple bargain made between insurers and those insured. In return, in the payment of premiums and copays for those insured, insurers agree to cover health care, including mental health care, of insured Georgians. The challenge for insured Georgians is how to know whether insurances are keeping their promises to cover mental health care, because all indications are that they are not. Numerous studies and surveys have found that many Georgians face discrimination by insurers in accessing mental health care, including inadequate networks of mental health care professionals that force Georgians either to pay more to get out of network care or forego needed health care when they do not have the financial resources. The second thing is below market reimbursement rates that discourage mental health professionals from joining an insurer's network. And third, forcing Georgians to pay more for behavioral health care than for medical and surgical care, i.e. higher copays, or subjecting them to onerous conditions, i.e. restricting care. At its core, SB 342 is the implementation of one of President Reagan's most well-known adages, trust but verify. The bill recognizes the need for transparency and accountability in the provisions of behavioral health care services to the citizens of Georgia. We urge passage of SB 342. Georgians are entitled to know if they are getting the value for their premium dollars, because promises should be kept. Thank you for the opportunity to speak to this committee, and thanks again, Senator Kirkpatrick, for continuing the efforts on parts of Georgia's behavioral health care community.
Okay, thank you. I don't see any questions. Appreciate you being here.
Thank you.
Jeff Breedlove?
Thank you, Mr. Chairman. I'm Jeff Breedlove. I'm representing the Georgia Council on Substance Abuse. I'm a person in long-term recovery, and we're here today in full support of this important bill by Senator Kirkpatrick. And to be brief, I do want to begin by thanking you, Senator, for your tireless leadership for the Georgia recovery community. And this bill will help families and peers very much, and we appreciate your leadership. Just briefly, at the end of the day, what we're asking for is for us to be in compliance with federal law, to the letter of the law and the spirit of the law, on behalf of Georgia families. We don't know what we don't know. Stories like what Kim just said are heart-tugging and important stories, but we need to know the facts. We need to know the numbers. We need to know the real impact. So I would just encourage you to give every support to this so that at the end of the day, Georgia is in compliance with federal law on behalf of our families. Thank you.
Thank you. Appreciate you being here. Jesse Weatherington?
Thank you, Mr. Chairman, members of the committee. My name is Jesse Weatherington. I'm the president of the Georgia Association of Health Plans, which represent the trade association representing the state-regulated insurance industry in the state. It's a good thing y'all are sitting down. We are here to support Senate Bill 342 today. The insurance industry is not opposed to parity. It has been the law of the land since 2008 federally. We think Senate Bill 342 is the right approach to empower the Department of Insurance to make those determinations. Obviously, there's been a lot of news and enforcement around this at the federal level. The Consolidated Appropriations Act of 2021 also had some additional enforcement, which we've seen news about recently. We know that insurers, we strive to do better every day, and we look forward to working with y'all and the Commissioner of Insurance as this moves forward. I'll reserve my comments there, Mr. Chairman.
Appreciate you being here, and you're working with the Senator on this issue and other issues. So it's nice to see kumbaya moments. And I don't see any questions for you. Thanks for being here.
Thanks, sir.
Not yet. One more, and then we'll let you. Whitney Griggs. I think that's Griggs, is that right? That's right, yeah. Okay. Please tell us who you represent as well, thanks.
My name is Whitney Griggs, and I am the Health Policy Analyst with Georgians for a Healthy Future. Thank you for the opportunity to speak with you this afternoon, and thank you, Senator Kirkpatrick, for taking up the charge on mental health parity. I don't have anything profound to add that my colleagues have not added, other than this is an incredibly important step to reducing the stigma, which is the major barrier to mental health treatment. And we're particularly interested in mental health and substance use treatment for Georgia's youth, and ensuring that we can capture youth substance use issues early on before they turn into adult substance use issues, and ensuring parity in treatment is a major step to that. So thank you so much for your consideration today, and we wholeheartedly support this bill.
Thank you for your brevity. Very good. We will let Senator Kirkpatrick close.
Yes, I wanted to thank the Insurance Commissioner's Office for working with us on this, and also all the stakeholders that we had conversations for several months about this. And I may have misled y'all on one thing. The Insurance Commissioner's Office probably is going to need some more money in their budget for staff. They need somebody qualified to analyze this data. And so I did not mean to imply that they didn't need more personnel, because they do, and I'm very happy to support their getting whatever they need on that.
And I do believe, having sat through 3 or 4 days of appropriations testimony, that there is some dollars coming to the agency to help them with their issues. I can promise you it's never enough, but I think it will help. Any other members have any questions for Senator Kirkpatrick? And if not, I am going to open the floor for a motion. We have a motion from Senator Robertson, a second from Senator Merritt. Okay. Any further discussion? If y'all would raise your hand if you're for due pass of Senate Bill 342, and the LC number on the substitute is 520067S. Raise your hand if you're for due pass. All right. I don't see anybody. Thank y'all for that. It looks like it was unanimous. Thank you for that. And Senator Kirkpatrick, it looks like we do have time to talk about your other bills. So.
Thank you, Mr. Chairman. I'm glad to hear that. This one is Senate Bill 341, and the LC number that I have is 520066S. Is that what you have? Okay.
Yep. We're good. Go ahead.
This bill is a continuation of the conversation about prior authorization that started last year with Senate Bill 80, adding transparency to this process for patients, physicians, and hospitals. The bill passed on day 40, and part of the process was removing the language about medications for people with chronic conditions. I committed to meeting with stakeholders during the off-season to come up with a way to make progress on that specific issue. We had several meetings with multiple stakeholders, and the result is this bill, which is modeled on a Kentucky bill. The essence of the bill is that patients with chronic conditions who are stable on medication would only have to go through prior authorization for that medication once a year. The prior authorization could be longer than a year, and that does occur frequently. There are some exceptions where the bill would not apply, including drugs for non-maintenance conditions, meds typically used for less than 12 months, meds for which the science does not support a 12-month approval, in other words, where a patient might need to be checked earlier for side effects or response to the medication. And the effective date of this legislation would be January 1st of 2023. I think that we've been able to reach an agreement among the parties that worked on this bill, and I appreciate the willingness of everyone to work with me on the bill. I'd be happy to answer any questions.
Thank you. So far, I don't see anybody raising their hand, so we'll go ahead with testimony and then give you a chance to close if we have any further questions. Bethany Scherer.
Hello. For
Once again, I'm Bethany Sher with Medical Association of Georgia, and we're here to support this piece of legislation. We are extremely grateful for the provisions that we put in place last year through Senate Bill 80, and appreciate this committee's consideration of that bill. And then as far as this bill, this is a really important step forward for helping patients with chronic conditions. Oftentimes our physicians find themselves having to get repeat prior authorizations for the same medication over and over again within a certain period of time. And while we respect that insurance companies are often using that to aid in making sure that a patient is still stable and doing well on medication, we want to make sure that patients with chronic conditions who are on maintenance medications and doing well don't have delays in receiving that health care.
Thank you. I don't see anybody with any questions. Appreciate you being here. Mr. Withington.
Thank you again, Mr. Chairman, members of the committee. Again, I'm Jesse Wethington. I'm here on behalf of the Georgia Association of Health Plans. We are here again to support Senate Bill 341 and substitute. This feels
Hallelujah.
Weird. This feels weird, y'all. And well, I want to express my gratitude to the sponsor. She's been fantastic to work with on this. We had several meetings over the interim, and I really want to applaud her. And so this is really the way that bills like this ought to be worked. These are complex issues, and we think this strikes the right balance between lowering the administrative burden and convenience for patients and their providers, as well as maintaining our ability to look for clinical safety and drug-drug interactions and things of that nature. So just appreciate it, and I think it's a good bill.
All right, thank you. I don't see any questions. Again, appreciate you being here, and thanks for working with the bill's author. Whitney Griggs. It's like deja vu here.
Hi, I'm Whitney Griggs. I'm with Georgians for a Healthy Future. Thank you, Senator Kirkpatrick, for coming back and revisiting the prior authorization bill that was passed last year. Georgians for a Healthy Future is supportive of any effort to ensure that Georgians have the access to the medical care they need to live productive, healthy lives, and being able to receive their medication for managing chronic conditions is a piece of that. Medication is oftentimes the most effective and cost-effective way to manage chronic diseases, and many Georgians don't just live with one chronic disease, but they live with multiple chronic diseases like asthma, high blood pressure, diabetes, and having to navigate multiple prior authorizations can delay their ability to get medication they need to live their lives. So we support the bill, and thank you again for your efforts.
Thank you again. Before I ask for motions, I do want to make a quick comment. I want to thank the chair lady for the work that she's done to get all parties to cooperate. I was assigned her as a mentor when she came in, and she has learned very well the process of having these meetings go much smoother by having a lot of work and meetings done ahead of the meeting. And so I want to, again, thank you for that. And I do appreciate the work that you're doing to help the healthcare delivery system in our state. Very important work, and you've been a champion. So thank you. I want to thank you personally for that. So I will open the floor to the members for a motion. We have a motion from Chairman Watson, do pass. I have a second from Senator Merritt. Thank you. Any further discussion on the committee? If not, please, those in favor of do pass or Senate Bill 341, and the substitute is 520066S. Please raise your hand. All right. Again, unanimous. It's just amazing when everybody comes together. All right, that's all the business we have today. Thanks, everybody, for being here on time, and we are adjourned.